Thank you for joining Governor Holcomb's briefing. It will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise My Hand button. When you are called upon, we will unmute your microphone, and then you will have to unmute your own microphone. Thank you.
Good afternoon. Thank you for joining us. Hopefully, again, I got one just quick housekeeping item in regards to our gathering tomorrow at 2:30. The Secretary of State, Connie Lawson, will join us. There's been some progress on the elections front, so she'll get us up to speed as the June 2nd date approaches, the primary election date approaches. And with that, I will turn it over to Dr. Box before we hear from a couple mayors right after Dr. Box.
Thank you, Governor Holcomb. Today we reported 440 new cases and unfortunately 49 additional deaths in the state of Indiana from COVID-19. Our testing numbers did increase after the holiday weekend, but still are not where I'd like to see them at 2,400 additional tests. Yesterday, we wrapped up the second day of our 4 drive-through clinics in Evansville, Fort Wayne, Gary, and Sellersburg. We tested a total of 430 people across 4 sites yesterday and now have tested nearly 900 people in 2 days. When you add that to the more than 900 people tested in Maryville last week, we've tested more than 1,800 additional Hoosiers in those 2 weeks, hoping to get those numbers up, of course. As we look at the details on the test reporting, you can see each of our counties and the number of tests that have been completed in each county. We can also, as we move forward, see the number of Indiana deaths assigned to each county. Looking at our ICU bed availability, this is staying very stable with about 46% of our ICU beds available, and of those in use, about 25% are for COVID-related individuals, and about 29% of those ICU beds are being used by non-COVID. When we look at our ventilator availability, about 74% of our ventilators are available, and of those in use, about 15% are being used for COVID-related patients and about 11% for non-COVID-related patients. Today, we also notified Hoosiers who are struggling with food insecurity about a new assistance program that's available at many food banks and pantries, especially in our rural areas and here in Marion County. ISDH received approval from the Disaster Distribution Program that now allows Hoosiers who have experienced significant financial losses to receive a 25-pound box of food from a participating food bank or pantry. I encourage Hoosiers to learn more at www.wic.in.gov or visit fssa.in.gov website to search for Indiana's food assistance map. Be sure you call ahead to make sure that your local food bank is participating in this disaster distribution program. Finally, I want to provide some clarification about the order which I issued yesterday regarding the transfer of residents from long-term care facilities and COVID-19 dedicated units. To be clear, the state of Indiana will not be ordering the transfer of any residents, nor will the state order a facility to become a COVID-only facility. This order is intended to allow facilities that already have COVID-positive patients to take others who have the same status so that they can be cared for in a way that best serves our residents, while at the same time allowing residents who are not infected to be relocated to a facility where they will have a decreased risk for exposure. Any move to create a COVID-designated facility will be initiated by the facility and will be made in consultation with the Indiana State Department of Health, with local health officials, the local hospitals, and with the local elected officials. Families must be notified before any transfer occurs. We want to make sure that a facility that wants to provide COVID-only case care has easy access to hospitals in case a patient's care or condition deteriorates. Unfortunately, we're seeing that happen far too often in this most vulnerable population. Of our 152 facilities already have positive COVID-19 cases in the state of Indiana, with at least one positive case. A total of 681 residents have tested positive across the state in these facilities, and that's about 1% of the population that live in our long-term care or residential facilities. These 681 positive cases account for about 7% of our total positive cases in the state. However, when you look at the 119 deaths in these long-term care and residential facilities, that accounts for about 27% of our deaths in the state. That's heartbreaking, but it's unfortunately an expected disparity, knowing that these individuals in these facilities are our highest risk population based on their age and their chronic health conditions. We also have had 512 staff in our long-term care and residential facilities that have fallen ill, and unfortunately, the death of one staff from these facilities. These are devastating losses for all of the families, but also for the staff of these facilities, because we know the staff, the chief medical officers, the administrators, all become very close to these residents, and it's devastating to see the number of individuals in their facilities that are ill with this disease and then sometimes losing their lives to this disease. In addition to helping facilities make the best decisions for their populations this week, ISDH pushed out an additional personal protective equipment directly to 16 of our long-term care facilities across the state, and another 21 local health departments who will be providing that personal protective equipment to long-term care facilities. We continue to send our strike teams out to test individuals in long-term care facilities daily and will not stop until we are sure we are through this pandemic. Thank you.
Thank you, Dr. Box. Next, we're going to check in, as we have done in the past, with a couple of our mayors, one in Terre Haute, Indiana, one in Valparaiso, Indiana. First, we'll go to Terre Haute and to Mayor Duke Bennett. First, Mayor, our condolences go out to the Schofstall family and to your administration for losing one of your finest. One of your first responders, firefighter John Schofstall. Please, if you would, pass on our condolences and our gratitude for what he meant, not just to the community, but to the profession and to our state. And then I'd just like, if you would, give us an update on the Wabash Valley region and Terre Haute, Indiana. I know we've been in contact, but if you could share just how much progress you're making during the storm, it would be appreciated.
Thank you, Governor, and just appreciate your condolences. It's been a tough last week, really, here, but the last few days, especially with the loss of our firefighter. Really appreciate the condolences that come in from all across the state. You know, it's these frontline people are just right out there fighting the battle for us, and this silent and invisible killer out there has taken a life of one of our public safety, true servant of our community. The community's rallied behind their family and firefighters, brothers and sisters, and what I can say is John will be greatly missed. So I thank you for those kind words, Governor, and I'll pass that on.
Thank you.
So when we kind of talk about what's going on in here in Terre Haute and the Wabash Valley, one of the first things that we tried to do was be in concert with your executive order. And so I championed a video campaign, which includes college presidents, our local hospital CEOs, business leaders, a variety of other people from our community but have all put videos together, short videos, and as we work with the media to get the message out about people staying home. You know, we've listened to Dr. Box and all the other professionals out there, and you know, we're following that guidance. And we wanted to make sure we did that in Terre Haute, and we're seeing a positive impact of that. Our numbers today were 45 positive tests, and unfortunately 3 deaths, including our firefighter. But this stay-at-home message is getting through, and so we appreciate your effort to get this "We're in this together" campaign started, and we hitched on to that and have had quite a bit of success here locally. It's we're just going to continue to do that until we get through this. The second thing I really wanted to talk about was we put together what we call the West Central Indiana Business Emergency Response Team. So it's a hub of professionals here locally, the Small Business Development Center, the Terre Haute Chamber of Commerce, a variety of other experts in a variety of fields related to all of this COVID-19 response for businesses. And so we have a one-stop shop for people to be able to get on the website, make a phone call, ask questions, get those questions answered here locally, or we can point them in the right direction to get to the right resources at that state and federal level. We just hope that we could take a little bit of burden off all of you folks to be able to get those questions answered. And so we're helping people apply for loans, just finding out what they can do with their employees as they're having to lay them off and those kinds of things. And so it's really kind of changed the way we do business. And I would suspect when this is over, this will be kind of a new model for us to use as we seek economic development and business growth in our community, to have all this under one umbrella. It's working very well. We're getting a great response. And so we're just trying to engage people in a way that we're answering those questions. There's a lot of questions out there, as you know, and that you guys are getting. And I think every day we face all kinds of challenges, and we've got some major projects underway here, and you know, we're excited about those, but this whole thing kind of sets things back a little bit. So we're trying to move ahead here locally. Our Capital Improvement Board approved us moving ahead to purchase the school corporation building so we can get our convention center built. We've got all of our colleges and universities doing the online thing they need to do. So, you know, we're a big education community, and we're just doing everything we can to overcome these challenges and just being strong and intentional about our decisions to make sure that we get through this as quickly as we can. But we're more than hitting the ground running when we get through with this. And so I'm personally grateful to you, Governor. You've done a tremendous job of leading us through this. And all of our state leaders, all of your staff, they've been very helpful to me personally and our community. And, you know, I really just want to, the last thing I want to say is just, you know, a special thanks to both of our local hospitals, our mental health providers, and our public safety officials, all those people on the front lines that are fighting this battle against the coronavirus on our behalf to keep us safe. I can't thank them enough for choosing that profession and stepping up to the plate. And so stay well, Indiana, and we're all in this together. Thank you, Governor.
Thank you. Well said and well led. So proud of your efforts. Next, we'll go to Valparaiso, Indiana, and to my friend Matt Murphy. Matt, you were sworn in. You, just like Mayor Duke Bennett said, hit the ground running, and then immediately this unprecedented challenge was put on your plate. As unfortunate as that was, we're fortunate that you're there, and can't express, just like with Mayor Duke Bennett, how grateful we are as a state to be able to work with you on a daily basis and partner with you. Can you, as Mayor Bennett did, can you kind of talk about Valparaiso, but also maybe even more generally about the region as well and all the progress that you've made to date?
Sure, absolutely. Good afternoon, Governor, and thank you for highlighting our region and for your ongoing leadership and support during these challenging times. Here in Valparaiso, I'm very pleased to report that our community is working together to address and limit the impact of COVID-19. First, we're in regular contact with our healthcare community and grateful for their expertise. Our Porter County Health Department is keeping us well updated regarding those affected. We're also working in partnership with both Porter Regional Hospital and St. Mary Medical Center, helping to secure needed supplies, which recently included a donation of 10,000 masks from our sister city in China. We're also standing by with an available building should the hospital need additional space or storage. You know, as a community, we're working together to ensure everyone has access to nutritional meals, especially school children and seniors. In addition to providing e-learning, the Valparaiso community school system is providing meals for students who need them. Already more than 27,000 meals have been distributed to families. For seniors, our Pines Village Retirement Community and the Visiting Nurse Association are delivering about 1,000 meals per week to homebound Hoosiers. Our Valparaiso Police Department has been proactive in educating our residents and business owners concerning allowable activities. I can report that Valparaiso residents have been heeding your stay-at-home order, and our local businesses have been operating within the confines and local directives. Our police department has also expanded their CARE program, which checks on vulnerable residents. We've reached out to the community to encourage residents to sign up themselves or a loved one. The police department checks on these folks regularly, assisting with any needs they may have. Last week, Valpo, working with the Red Cross, also came together for a blood drive here at City Hall. Using very safe collection techniques, we were able to collect 43 pints of blood, saving lives. We were very grateful for everyone who came out. In partnership with our local Chamber of Commerce, we're working to keep our residents informed. Together, we host a weekly telephone update on Monday mornings, typically attended by more than 130 people on the phone. Then we post a recording so that other residents can tune in later. To further support our businesses and restaurant community, we've set up designated parking zones for pickup orders in our downtown, and we're promoting the use of those businesses. Also, to further support our residents in the community and our businesses in need of employment, the Valpo Chamber of Commerce has created a job board on their website so businesses can post opportunities and residents can apply easily. I check this board regularly and the opportunities increase every day. Certainly all of our essential workers are hard at work and we're grateful. But our departments in the city are also stepping up to provide services beyond the basics to provide what the community wants right now. And believe it or not, even though it snowed today here in Valpo, our residents want to get out and work in their yards and beautify their yards. So we've worked together to start compost and mulching services to get those back up and running. And we're glad to see people out getting some fresh air and working in their yards. And we're just grateful for those departments' efforts. So many are doing so much. Our Porter County Library system has added more than 1 million digital titles and added a digital card so everyone can access movies, music, classes, and concerts and more. And finally, Governor, we have an eye on the future. We're already planning for when this pandemic subsides and it's safe for people to congregate. We're working with our local businesses to aggressively promote our community and encourage residents and guests to fully enjoy all that Valparaiso has to offer. In closing, there are just so many people to thank right now. Our healthcare workers, our grocery store employees, our first responders, and our entire community for taking this health crisis seriously and working daily to practice social distancing and at the same time look after each other. We're optimistic for the days ahead because we're inspired by what we see here in Valparaiso, and I want to thank each person and each organization for doing their part. Thank you.
Thank you, Mayor. We're inspired by what you're doing, and you remind us of just how long the state of Indiana is when you say it. There was snow in Valpo today. I hope Jeffersonville and Evansville heard that. Leavenworth, Indiana heard that. And I also, there may not be 43 people in the State House today, but I take your 43 pints of blood as a challenge, and that is so good of you to do. And the Red Cross is in need, not just in the state of Indiana, but across the country. And so thank you for doing that with everything else that's going on. That cannot be forgotten. You also, both Mayor Bennett and Mayor Murphy, remind us, and Senator Young did yesterday, that while much of our lives has slowed down or maybe come to a halt, on the other hand, life goes on. And we're dealing with some of the same challenges, whether it's feeding the hungry or if folks need rides places to pick up their meds. And these mayors just epitomize that effectiveness and that leadership. And so we'll have a couple more mayors on next week as well, so folks can understand that we are truly in this together as a state, as our local government, and our federal partners. Mayor Murphy just mentioned those meals getting delivered. That's happening all over the state of Indiana. Our schools certainly haven't come to a screeching halt, not just in terms of instruction that's occurring, but also the meals that are being delivered. Knox Community Schools, they deliver about 550 meals every Monday. This is going out to make sure that students have lunch and breakfast, and bus drivers are coming in and they're volunteering their time, locally volunteering. One such case, they were out delivering meals here recently and went up to the house and something didn't smell right and turned out to be a gas leak. And so in this case, not only were they providing food, but they probably saved a life. At least that's what the mom said when she called in the very next day and was thankful that someone was there and could intervene and help evacuate the family right there on the spot. This is neighbors looking after neighbors, and it's how we're getting through this all together. Last week, storms came through, talking about life continuing to go on and Mother Nature still expressing herself. And storms came through down in much of southern Indiana, central and southern Indiana. Power was out in the Versailles area. But the cafeteria workers in South Ripley schools, they were out delivering meals, but they added another 750 to their meal preparation to feed the police and the EMS and the firefighters and all those first responders that were out clearing and repairing and assisting their neighbors. So you see these kinds of acts of extraordinary gestures. In Crawfordsville, Indiana, they quickly realized that some of the families that couldn't come to the school to pick up their meals in a central location, and Southmont Schools is delivering over 8,000 breakfasts and lunches each week to about 575 students. So we're finding a way to get through this together, and it starts maybe in a city hall, or it maybe starts in a school or the fire department, et cetera. But it just underscores this team effort from the local to the state and to the federal. So I'm going to continue to kind of highlight the ways that we're all coming together. And I think that's why we're making so much progress in a very methodical way, and that's our secret sauce. So with that, we'll get right to the question portion of this segment.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. There's been a lot of talk about what it looks like to reopen the economy. And so I'm curious if you could talk about what your plan might look like. I mean, is it restaurants only being half full, for example? And are you working with the governors in other states like Ohio and Kentucky on a coordinated plan to reopen the economy?
Yeah, two obviously very good questions and very realistic, very timely. Yes, we're looking at everything that you just mentioned and a lot more. If you look at it in terms of where we are right now, we're still letting, and we'll always be in this situation where we're letting the data drive our decisions. And so we're looking at the cases, and we're looking at the deaths, and we're looking at our testing capability to get to the most vulnerable, to our first line responders, et cetera. We're also contemplating how we're going to be able to track former positive cases and how they've recovered and at what stage they're in, ready to return to when we do reopen on a larger scale. But in terms of how we will reopen or re-engage on the economic front, it'll be a rolling reopen. It won't be all at once. It won't be flipping a light switch. It'll contemplate, as you say, and we're working with the business community. I'll later today be communicating to multiple and various associations throughout the state of Indiana that are soliciting their input on how they can safely, when that day comes, conduct business. We want to make sure that employees have a very high level of confidence about the workplace. But again, we're going to be looking at, the steady, sustained decline in those numbers. We'll be looking at our supply chain. Is it sufficient? Our PPE levels, our hospital beds, our vents. We'll be looking at like I said, our testing ability, our tracing ability. We'll be looking at these new workplace accommodations, working with the different sectors in our economy, and then we'll have a safe start. And like I said, it'll be a rolling start. Of course, and I have, as early as today, on multiple occasions, I've been in touch with the governor of Kentucky, Andy Beshear, and the governor of Ohio, Mike DeWine. I've also reached out to the governor of Illinois, and we've reached out to the governor of Michigan. So I want to make sure that we all know, because we're neighborly and share a border, and for every action, sometimes there's an equal or greater reaction. And so we don't want to we're not going to act alone in this. We're all in this together, wherever you start in the state of Indiana, and as you rise up and get to a higher altitude, travel patterns are affected by the coronavirus, or the coronavirus affects travel patterns, and vice versa. So yes, to all the above. Again, we'll have a very, when the numbers warrant, when it is safe to start. That was the whole purpose when we asked Chris Johnston at OMB and Jim Schellinger, the Secretary of Commerce here, to help lead that effort statewide to get our economy going back again. I've said from day one, and we take 2 steps forward most days, and every day I hear the report about the Hoosiers that we've lost, I feel like we've taken a step back, but we're taking 2 steps at least forward every day. And we're on the right path, and we're making progress every day. But I've said from day one that while we may be one of the first to go into this, my goal is to get us to be one of the first out of it and to have a healthy workforce ready to go.
Jeff Smith, WLFI.
Hello, Jeff. Good afternoon.
Good afternoon, Governor. Thanks for letting me in. Weather report, it snowed in my hometown of Valpo today, and it snowed in my adopted hometown in Lafayette. So
You're blessed.
Hey, Representative Congressman Hollingsworth said yesterday that it's the American government's position to say the choice between the loss of our way of life as Americans and the loss of life of Americans' lives. We have to choose the latter. I'd be interested in your thoughts on that point of view.
Well, it's not an either-or choice or decision. I want to get us back to work as soon as it's safe, and that's my job. That'll be our priority. And just to repeat, not to sound like a skipping record, but to repeat, we'll do that when it's safe to do that. We want a safe workforce on the ground as soon as we can get there. But the measures and the practices that we're taking right now are helping us get there.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. 2 quick questions. One from a local business person who approached me actually about a half hour ago before your news conference started. He said that sales taxes, I guess, from the state of Indiana are technically due on Monday the 20th. And is that still due, since they have been collecting sales tax revenue because of the closure and shutdown? And number 2, Governor, I guess this would be for you. We did some polling at Indy Politics. We found out your approval rating with the Hoosiers is 63%. The state's at 64%. 81% support the stay-at-home order and social distancing. How much longer do you think you can enjoy that sort of broad support with where we are now before folks maybe get really, really antsy and just start ignoring the government?
That's not the data or the data that we pay attention to, Abdul, quite honestly. We're looking at first and only the safety of Hoosiers and how we, the policies that we put into place, are they effective? Are they working? I'm pleased to hear you say that Hoosiers support those policies. I don't doubt it. I hear from I hear from Hoosiers every day. And Dr. Box hears from Hoosiers every day. And a lot of the steps that we're taking are coming from areas of expertise that are making these recommendations. And so we don't just reach into the dark and find our way through it. These are not just inspired decisions, but they're informed. And we'll let the polling take care of itself. Chris, you want to talk about April 20th?
Sure. The tax deferral date that today is tax day for income taxes, that was deferred to July 15th, but the sales tax that is due on the 20th is still due on that day. I understand, Abdul, the person you're talking to, may not have as much sales tax as in the past, but it is still due on the 20th.
Dominic Miranda, WTHI.
Hello, Dominic. Good afternoon.
Good afternoon, Governor. I have two questions for you today. First, I just want to ask you about the incredibly unfortunate passing of the firefighter in Terre Haute. I heard you mention it with Mayor Bennett. Obviously, the community here in Terre Haute is very shaken because of this. But I do want to ask you just kind of what this message sends to, this virus knows no profession, and, just reinforcing the seriousness of this virus and how important our first responders are and how they truly are putting their lives on the line for us. Just wanted to get your thoughts on that.
Yeah, our first responders obviously have always been heroic. It's exceptionally tough to lose one because they know exactly when they put the uniform on what their purpose in life is, and that is to help us avoid danger or get through it. And they put so much on their shoulders selflessly, and they could be doing a million other things less challenging, and yet they choose one of the most not just difficult but oftentimes taken for granted, quite frankly. And to lose someone like John Schaafstall in a community where he is counted on by so many, looked up to by so many, it's difficult. And it reminds us of how close-knit we all are and how we truly do rely on each other. He was taken away from us far too early, but I suspect every day that he put the uniform on and went out there and did his job, he knew exactly what he was doing. And so couldn't have more respect for him. And again, Janet and mine and Dr. Box and everyone on this task force that's surrounded and consumed by COVID-19, our thoughts and prayers go out to his entire family. And when I say family, I mean his extended family in the Wabash Valley region.
Kayla Sullivan, Fox 59.
Good afternoon, Kayla.
Kayla, you should be able to speak. We'll come back to Kayla. Rob Burgess, Wabash Plain Dealer.
Good afternoon, Rob.
Hey, good afternoon, Governor. I wanted to ask Dr. Box, when can we expect county-level data of some of the demographic data that's on the website now and information about beds and ventilators on a county level as well? And then this question was for the mayors. How are customers and local governments there in your community supporting small businesses during this time? Are you offering any emergency loans to local businesses? And are local businesses in your communities having any difficulties applying for Paycheck Protection Program loans?
So with regards to county level data, with regards to ventilators, that is all in our platform EM resource and is basically your local hospitals can give you the information about their percentage of ventilators. I just look at the aggregate data and don't have all that individual data, nor do I want to get in the habit of starting to report all that individual data on a regular basis. But your local hospitals or your regional HCCs, healthcare coalitions, may be interested in sharing that with you. And the other part of the question?
Rachel, are the mayors still available to respond themselves? Mayor Bennett or Mayor Murphy, you want to chime in?
Yeah, I'm here, Mayor Bennett. We don't have any local programs where we're assisting, but we've had quite a bit of success with local businesses to be able to access some of the loans you described. And our local community's stepping up and trying to help. It's primarily restaurants. That's the small businesses that are open as a majority, but people are trying to do their part to help keep them going. So we're doing what we can.
Mayor Murphy.
Yeah, Governor, same here in Valpo. We don't have any local programs, but our community's stepping up as much as they can to help these restaurants with carry out orders. And, it's really amazing to see the community come together during these challenging times. And so we're hopeful that when it's opened up, we get them back where they need to be. But we're encouraging our businesses to take advantage of all the programs that the federal government is putting on now, the PPP, and really putting their efforts there in terms of the federal programs.
Thank you, Mayor. And I just might add, not to speak for them, wouldn't want to do that, but earlier we had the mayor of Evansville, the mayor of Indianapolis, and the mayor of Fort Wayne, and they all talked about it. And I know down in Jeffersonville and Clark County in that area, Rob, there's also some chambers of commerce that have come together that have some response funding programs available as well.
Tom Davies, The Associated Press.
Hello, Tom. Good afternoon.
Hello, Governor. How important is it going to be for contact tracing going forward to easing restrictions? Has the state started any steps towards that, such as hiring or training staff? And how quickly might the state be able to do sufficient training? And then along with that, what's preventing, this might be for Dr. Box, what's preventing you from getting to the level of testing you believe is sufficient around the state? Is it supplies or staffing that you need?
It's neither. I just need people to test more and to come through our drive-thrus. We are working very hard to just open the testing up, and we want our providers that are seeing patients in their clinic and the office, our providers that are seeing patients in emergency rooms and in med checks. We want individuals, if you think someone's sick with COVID-19, especially if they have any of those higher risk conditions, their age or high blood pressure, diabetes, heart disease, to please test them. We do have the ability to run more tests, and we want to do that, and that's why we've opened up our drive-through to include more individuals. And the other thing was the contact tracing. The contact tracing has been going on from day one. We have been working with all of our local health departments across the state to follow up every positive individual, to find out who they've been in very close contact with, and then to either notify those individuals or have those individuals notify them. A big part of contact tracing going forward, though, and has been in the past, is individuals that have been exposed but are not showing symptoms, the need for them to quarantine for the next 14 days because they may show up with symptoms, and we don't want them to infect multiple people before they are symptomatic and they don't realize that they're sick. And it's really important for us to isolate those people and test those people that have symptoms. The concern about that, of course, in the past has been, and hopefully in the future we'll be able to do more of this, is to have that testing locally available right at that moment. So when we do have the ability in more cassettes to run those very quick tests that we can do within about 10 to 15 minutes, that will really help us to be able to contact trace, quarantine, and isolate even better.
Thank you, Tom.
Nikki Kelly, Fort Wayne Journal-Gazette.
Hello, Nikki. How are you?
You. I wanted to follow up kind of on that testing question. When do you think people who are symptomatic, just period, whether they're at high risk or not, can get tested? And also, some other states and cities have seen a rise in people dying at home versus in a hospital setting, and I wondered if we've seen that at all.
We actually have, both very good questions. I think we're really close to being able to say, and I think our providers should be saying that now, because they can send through LabCorp or another lab that we don't require a quick turnaround. LabCorp, to my understanding, is down to a 3 to 5 day turnaround versus the 10 to 12 days when they had a big backlog for the entire nation. So the fact that someone could come in and see a provider and get tested and that could get sent, I would strongly recommend that be done now for anybody that's symptomatic for sure. With regards, what was the second part?
People dying at home.
Oh, this is really interesting and very sad, and something that I'm glad you asked me about. we're not even seeing the same number of people that are showing up in our emergency rooms with heart attacks, strokes, and other things. In fact, what we're seeing is an increase of individuals who are dying at home from things that look like heart attacks and other problems. So I think that individuals have been very careful to not want to go to the hospital or go to the emergency room because they're afraid of getting infected. I think also that they are trying to not be a burden on the emergency room. But my plea to you would be that if you're ill and you talk to your healthcare professional and they think you need to be seen, or if you're ill and emergently need to be taken, call 911. That's what we're there for. That's what we want to do. We don't want people to die in increasing numbers in our state that is not related to COVID-19. So Dr. Kaufman with our EMS is here, and I'm going to let him just address that because I know he's been talking to me about these numbers.
So important.
Yeah, hi, Dr. Mike Kaufman, State EMS Medical Director with the Department of Homeland Security. To speak to the question and follow up on Dr. Box's comments, this is something that we track as part of our data, and we have seen an increase in the number of cardiac arrests and other out of hospital deaths. And the emergency departments, as well as our EMS providers' volume, has continued to be low. We have capacity in the healthcare system to care for patients. So don't hesitate to call 911 when your condition requires you to do so. I want to assure you that the public safety system, our EMS system, will be there to respond to you if you have a need. And our providers, our healthcare providers within our emergency departments will also be there to care for you. Folks are doing what they were told to do, and that's to hunker down and stay home. But I want you to know that the healthcare system and the EMS system is available and ready to respond should you need assistance.
Yeah, and this is so important, and why we've worked so hard to build up that capacity and to work together region by region. You're not going to overwhelm our system. And that's what we're very transparent about where we are on a daily basis in beds and ventilators and personnel. Please, please heed their call. And if you need to make the call, we'll be there for you.
Eric Berman, WIBC.
Hello, Eric. Good afternoon.
Good afternoon, Governor. And thank you for the segue, because that's exactly what I wanted to ask you about. When you talk about going or looking region by region, when it comes time to reopen the economy, is that something that, or reopen businesses, is that something that can be done regionally, or is that going to be statewide when it happens? And or a related point, probably more for Dr. Box, are we seeing a flattening of the curve statewide? We know where there's lots of cases, like in Southeast Indiana and Lake County and Central Indiana, but are we seeing the curve continue to go up in some regions as opposed to others?
Yeah, I can answer your first question in one word: yes. It can be. Like I said, this virus knows no boundary, whether it's artificial or drawn. And so we do look at different regions, just like the different parts of the country. Now, that works both ways. So we'll keep that in mind, but we will absolutely be looking at the numbers as they are or where they are.
So I hesitate to say this, but I do think we may be seeing a flattening of that curve. We may be seeing that peak flattened and that kind of plateauing effect. That may not be in every area, but we've actually, in some areas in the Southeast, seen their numbers of hospitalized patients, of ventilated patients fall. As you can look at our ventilators and our ICU beds, they've actually only gone up over the last week to 10 days in Marion County. So I'm cautiously optimistic that everything that we have done has really tremendously made a difference.
It would be a much different picture today if Hoosiers weren't all in this together, playing by the rules. What we can't do is pull up short. We don't want to count our chickens before they hatch. And so we've got a plan in place. We will update this come Monday, but not until then.
Kayla Sullivan, Box 59.
Kayla, you're back. Unmuted.
Can you hear me this time?
Perfectly.
Oh, beautiful. I love technology. Okay, so my question would be, are you considering a mask wearing requirement like the governor in New York?
Everything's on the table, especially in terms of when we start to reopen in different facilities. But that's part of what's happening right now in terms of what the standards will be in physical distancing, wearing of masks, testing at the workplace, all these things. It'll be a list, and we're soliciting as of today. It's part of Jim Schellinger and Chris Johnson's job. That whole committee is reaching out to associations all over the state of Indiana saying, because quite frankly, Kayla, we've got a lot of businesses who are doing that right now. A lot of best practices, essential businesses that are running right now who have already taken these steps. And so we're looking at a lot of plans from Hoosier businesses that have really stepped up, and they're way ahead of the game. They're taking care of their employees and conducting that essential business. So we're looking at all that information, and absolutely it will contemplate masks. But you might want to take, I think what Kayla was getting at, I wasn't trying to answer a question she didn't ask, but I think she's asking just in general, do we want the public all wearing masks?
Mm-hmm. You know, Kayla, I think that's a really good question. I think that we are coming to a point with manufacturing masks here in the state that we might be able to do that as we go back out. Even the homemade masks work for this. And again, the purpose of that mask when you're in public is that in case you're an asymptomatic carrier, you don't have any symptoms or you're pre-symptomatic, we don't want you to infect someone else, especially someone that is at higher risk. So the careful hand washing and, opening doors with a tissue or your sleeve and the making sure that you have a mask on are all things that we're going to need to follow until we can really start to test people to see if they're immune to this disease. Maybe they had it and they didn't know it, or they had a mild cold and they think, well, it was that, and we can prove that. And or second, we have that vaccine that we can give individuals so that we know that we'll have more herd immunity.
Michael, WBEZ.
Hello, Michael. Good afternoon.
Good afternoon, Governor, and good afternoon to you too, Dr. Box. You guys have been providing so much great information, and I hope my questions haven't been too tough on you.
We're still here.
Actually, Mike, I have two questions for the governor. Governor, Indiana's Legislative Black Caucus sent you a letter yesterday asking you to establish a task force to address the racial disparities with the COVID-19 virus. What's your thought on establishing such a task force? And there's been some issues facing the nation's food supply. Some meat processing plants are facing issues with COVID-19. What's the situation here in Indiana, and how are workers in agriculture being protected?
You want to take the second one, or you want?
The second one?
Sure.
Sure. So the food supply chain, to my knowledge, in the state of Indiana has not been an issue with regards to any of our processing plants or anything else. I know that our farmers are probably looking forward if we can get the snow and the cold weather and the rain to stop to getting crops in. And I know that we have not had issues with that supply chain. Now, from coming outside the state, that may be more of an issue going forward. But most of those individuals, if they work in close contact, again, are wearing masks, or they're working in shifts so that they can be separated at least 6 feet apart. And then when they take breaks or have lunch, they don't do that in a big congregate group in one area.
Yeah, and I would just say, Michael, we have a task force set up. We're going through this right now, and I want more information, not less. Look forward to continuing to work with the Black Caucus in addressing any issue of whether it's disparity or inequality. They're different, of course. Everything we do here, all throughout session, all throughout the rest of the year, is geared at providing equal opportunity for all in the state of Indiana. Whether it's a health program, whether it's addressing infant mortality. If we go and we look at the 13 different zip codes, that's probably close, it may not be exact, but the 13 zip codes that we need to provide more funding towards in terms of infant mortality, we do that. In terms of our workforce development programs, Fred Payne's here today, we offer programs for all. What we have to do is continue to provide the awareness for all, because we have different challenges in our urban areas and different challenges in our rural areas, and suburban for that matter. We heard yesterday about some internet connection issues in our urban areas. And there are some internet connection issues in our rural areas as well. So the beautiful thing about what we're doing is we're going through this thing together. And we're here every day at 2:30, and we want more information, not less. And we'll continue to get at every area of inequality or disparity. And we have to work with one another to do that.
Sherry, the Indianapolis Star.
Hello, Sherry. Good afternoon.
Good afternoon, Governor. Good afternoon, Dr. Box. Thank you for taking my question. Dr. Box, I want to return to this contact tracing question and ask, I know some states, Massachusetts, for instance, is going to be hiring an additional 1,000 people to work as contact tracers. Do you have an initiative underway to hire more people here? Do you feel that what we have in place would in any way cover it? And how do you get to that point of building up? I believe the Massachusetts commissioner referred to it as like an army of contact tracers.
And that's exactly correct. And the CDC just came out with their guidance of how they want this to be specifically traced, and we've been looking at that very carefully. We have been using volunteer students from our public health schools at Fairbanks and Bloomington, Purdue, to help supplement. We have been helping a lot of the local health departments across the state. But as we go forward and want to open up more things and have more testing, especially when we're able to start testing for immunity, we really truly are going to need, as they say, an army. So there are different ways of doing that. Some of that is technologically to do that tracing on an app on a phone, and we've been looking at all of those. Some of it is through Google Maps. Some of it is through just hiring an army of volunteers, and we're currently looking at all of those different options right now.
And this, Sherry, this will be a key part of our plan. So that army, if we need to fund it, we will.
Whitney Downard, CNHI.
Hello, Whitney. Good afternoon.
Good afternoon. My question is also for Dr. Box. One of the things that the Indiana Black Legislative Caucus mentioned yesterday, along with their proposed task force, was actually that these disparities, a lot of these health disparities existed before this pandemic hit. And, there were higher rates of diabetes, cigarettes, et cetera. What are some of the ways that even after this pandemic subsides that we can focus in Indiana on addressing those health disparities in the Black Hoosier population?
It's a great question, and I think that, addressing those disparities in the middle of a pandemic is difficult because, as you say, we have more African American individuals that have higher incidence of diabetes and high blood pressure and heart disease and sometimes obesity, and all of those things are risk factors for this particular disease. So that is why, as the governor said, we have all of our programming, we have been working very, very hard to make sure that we are addressing those disparities. If we write to a grant, for instance, I make sure that how are we addressing the disparate population that is most affected with this. If we set up something like our OB Navigator program, the whole concept there is making sure that those individuals that have barriers to getting health care and to getting the things that they need to have a healthy pregnancy, just not for the baby, but also for mom, that we're removing those barriers. Expanding health care through things like HIP 2.0, all of those are directed at trying to make sure that we are covering this disparate population and making sure that we take them with everything that we do at the top of our priority list.
Stephanie Wade, WRTV.
Good afternoon, Stephanie.
Hey, Governor and Dr. Box. It's been a while. Good to talk to you both again.
Welcome back.
Thank you. We've been hearing of hotels and other facilities that are offering up places to stay for healthcare workers. Airbnb has also started a frontline stays program. Are you guys aware of this? Are you partnering with any facilities to perhaps help? And just what do you think about this?
I think it's a great idea. As you know, we partnered with one hotel to help with our homeless population, especially those that were COVID suspected or COVID positive. And we are also working to partner with that same chain to potentially do something right here in the Marion County area and other places across the state where they have sites. I know that we've actually been talking with them in a contractual a way to try to set something up.
Yeah, and I'd say, Stephanie, it's so heartwarming, that Alexandra, I hate to pick one out, I'm going to have to devote devote some time maybe tomorrow or the next day toward this topic. But for our first responders, for those folks who are on the front lines, for them not to have to worry about going home and potentially, if they've got someone at home who has some health issues ongoing. I know at the Alexander here, there's such a firefighter that's been able to safely find quarter in a hotel and not have to worry about their job at work and then their job as dad at home. And so it is immensely appreciated what folks are doing to go out of their way to get us through this, one family at a time.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Good afternoon, Governor. Thanks for taking the time to do this. ARIA, a Carmel-based financial firm, donated, or actually sent 55,000 tests for COVID to New York City. Have you been in conversation at all with this firm? And is there any plan to contract with them to get them to test more Hoosiers?
We have. It's not a plan. We are. This firm is not just turns out good Hoosiers, but they're good Americans. You want to add anything to that?
Hey, as soon as we found out they were giving something to New York City, we of course called and got on the list, and so they've actually provided us swabs, and we'll be in the process of providing more swabs for testing for us. So it's very, very much appreciated from us.
Our final question is from Jenny with Wish TV.
Hello, Jenny. Good afternoon.
Good afternoon. My question is about grocery store workers. The United Food and Commercial Workers Union and Kroger, as you guys probably know, both urging elected officials to give grocery store workers that first responder or emergency personnel designation. This would ensure workers get, the masks, the gloves, other PPE. Is this something that Indiana is looking at doing or something you guys are considering?
I'll turn it over to you, and if you give me 2 seconds. Grocery store workers were deemed essential very early on, and they have occupied a priority location. And what I mean by that is in terms of testing, in terms of childcare offerings that we have. And so we're obviously working with the grocery store chains and making sure that if they feel like they're showing, or if they're showing a symptom, then they can be tested. They are part of our front line.
And I think, the problem with gloves is that people sometimes get a false sense of security and they do the same thing. They touch their face or their eyes with it. And again, it's all about washing your hands. And so that ability to have some type of wipe there or to have alcohol there and do that on a regular basis. I've seen a lot of stores that have actually put like plexiglass up to kind of prevent the public from, actually being able to sneeze, cough, or even just when they exhale, maybe that virus could infect that individual. Again, the mask can be very helpful, and that could be something as simple as a mask that someone makes for them at home. But I think that that's a very important part, and that's why we have included our grocery store workers and those individuals that have to do with our food supply chain as our essential workers, because we really know how critical they are and that they are exposed to the public every day.
Yeah, we appreciate everyone being with us today, and we look forward to seeing you hopefully tomorrow as well at 2:30. We'll be back at 2:30. We'll just, again, I'll end where we started. I'd ask you to keep John Schaufstall and his family in your prayers and in your thoughts, and also Brianne Leith, Officer Leith, who we lost here in Indianapolis. There'll be a service honoring her tomorrow at 11 o'clock. Eastern, but we'll be here at 2:30.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m. Eastern.